Geneveve Heinse lives in Masiphumelele outside Cape Town with her children. 3 years ago, while pregnant with her fourth child, she discovered she was HIV positive.
I was feeling a little bit like vomiting noises, and then I was losing some appetite. When I reached by the clinic is when they do the test on me, and then they discovered that I'm HIV positive. I started the treatment, but it didn't fit my body systemly, and then I went back to them, and then they changed my treatment that I was having.
Geneveve is one of 7.8 million South Africans living with HIV, and 75% of those are on antiretroviral treatment.
At first I was scared and I was afraid because I didn't know how people would react or how they would judge me.
But then she found others who were also positive.
Like I always tell them, we're all human beings. You don't need to be afraid, because if there is a problem, you need to come out with it.
Every few months, she collects her medication from the local clinic.
They draw some blood and then they do the testing, and then they give you the medication and they give you another date to come back to get the results. After the results, they'll give you another date to come in back to collect the medication.
Dr. Elsie van Straten, a public health practitioner at Geneveve Health Institute, is excited about the progress made in HIV treatment over the past 5 years.
We've actually made significant strides in a very short amount of time. We have this new medication, TLD. You only have to take it once a day. It's one tablet. Now, for the past year, we've been able to use it in our children as well. So this has made a significant difference. Another very interesting thing in the HIV field is that we can prevent HIV with a medication we call PrEP. It is a daily tablet. But we do see that even though patients are very excited to start the medication, it's very difficult to stay on this medication for a long time. And it can only prevent HIV if you take that medication every day. And we are starting to use it in some pilot sites in South Africa. It's a 2-monthly injectable HIV prevention medication.
In South Africa, about 55% of TB patients also have HIV. And these patients are at a higher risk of dying from TB, despite it being curable. But the advances in HIV treatment have made a big difference to TB.
We can now tell you within 2 hours whether you have drug-sensitive or drug-resistant TB by looking at your sputum. We also have very interesting things that we're rolling out for your chest X-ray, where a computer AI program can look through a lot of chest X-rays to see who might have TB and flag that for a doctor.
TB is highly contagious as it spreads through airborne droplets and is still the leading cause of death in South Africa.
Around drug-resistant TB, we have come a very long way in a very short time. In the past, we had to treat you for between 9 and 12 months. You needed a daily injection. A lot of our patients actually went deaf because of the medication, where now it can be as short as 6 months and you don't need an injection anymore.
It remains a struggle to get both TB and HIV patients to keep taking their medication. But the good news is,
we really are at the best stage in history when it comes to both TB and HIV. We have extremely good diagnostics at the moment. You'll be able to be tested in a very short time, and it's painless. We have prevention medication both for TB and HIV. And if you do have TB and HIV, we have some of the best medication we've ever had.
When you have the support system, it gives you the hope to continue. And I'm still living like a normal person, like any healthy other person.